Could you film from up down so I can check his dorsiflexion? So, Ed, tell me what your limit is. Tell me how much we could extend your foot without it being painful.
That's about it.
That's about it. Okay,
Yeah.
so my measurement, instead of taking measurements all that, it's real objective, subjective. I'm going to go by the creases in his foot. So right now, can you let that drop? So this is full plantar flexion. So we could dorsiflex it up until about, it's not even 90. See all these folds here? So my conclusion is the more wrinkles we have, the more dorsiflexion we're going to get. And until we could get more extension dorsiflexion there, he's not going to have a normal gait pattern. So go ahead and relax that right there. Right. And we'll get a new one. Pull this out here. So I put the emollient on so it doesn't cause much friction, irritation of the skin. All right. And I'm just going to start by kind of fanning and warming up the tissue around the lateral malleolus. You can see all the edema and the dorsal aspect to the metatarsals. So again, I'm just kind of encouraging the lymphatics and the vascular system and helping that to pump all this edema out. And along the way, we can actually feel some adhesions in here. Yeah. And this will help break that up as well. And again, I've seen people, athletes they've had inversion sprains of the anterior talofibular ligament, which is right here, right? Between the talus and the lateral malleolus right here. And by doing this, I mean, they've got back into their activities and even running, and sometimes days just after doing this, because we were able to increase the healing response. The body's natural reaction to acute injuries, ligament tears. Inflammation isn't a bad thing when it's an acute. It's part of the healing process because you get pavementing, rolling of new tissue that forms that matrix of the tissue again. But if there's too much adhesions, you're not going to get the flexibility. So this kind of breaks the adhesions down. So when the actin myosin, when they reform and all the soft tissue, it slides more smoothly after we break it down with this. So you feel that gristle in there? Mm-hmm. Yeah. See, that's other adhesions that we need to break down, which is, of course, is going to assist with your range of motion and rehabilitation. Now, I'm not going to go over the stitches because they're going to be taken out. But after these stitches are taken out, definitely when the scar is all healed, we want to come in here and we're going to do this more aggressively. All right. And that'll also help break up all these extra adhesions that we don't want. So I'm just going to kind of frame the Achilles tendon right here. So I always start out with, this is the convex tool, and we are treating a concave and convex surface. So you feel that bump there, adhesion. All this has to be breaking down. So combining the M6 robotic laser, which is photonically increasing circulation and healing the tissue, combining that with the manual laser edge myofascial release tools, we just get a healing response that is multiple times faster than if you had done one of these treatments solely. And the trifecta of this treatment is we're also assisting the healing of the soft tissue, even the bone, is this solenoid here, which may mimic an open MRI. It's actually pulsed electromagnetic field therapy, and PEMF has been cleared by the FDA for post-surgical pain and swelling and fracture. So it actually increases the healing response and actually the formation of new bone tissue. So obviously what the magnet is doing is putting pulsed ions into the tissue, probably increasing the stem cell expression in the bone matrix. PEMF was put in the NASA, in the space shuttles for the astronauts, because when you leave the Earth's pulsed electromagnetic field, the astronauts were losing bone and muscle, because our body's an electrical system, and if we don't have that electromagnetic field, we atrophy and the bones, they start degenerating. So putting a higher strength field right after the surgery obviously is going to increase the healing response for the bone matrix and soft tissue multiple fold as well. So, and orchestrating the class 4 laser photonic energy, the mechanical stimulation, the healing, and the pulsed electromagnetic field therapy, he's going to recover, like I said, probably 10 times faster than if he didn't do anything. If he just did prices, pressure, rest, ice, compression, elevation, which he still needs to do at home, but having these 3 treatments is really essential to accelerate the healing. So I'm just going to release this a little more with the convex tool, so that fits right along the Achilles tendon real perfectly right there. And then that, some people, they're real sensitive, but they become desensitized. It actually feels like a nice massage. I mean, if you were trying to do this with your thumbs, I mean, you have to put a lot of pressure, be uncomfortable. With these stainless steel instruments, if we hit an adhesion, it actually feels like we're going over some sandpaper, or it's like griddly. So we know how much pressure to put, and the patient could feel that as well. Feel that griddle right there, Ed?
Yeah.
Now, does that almost feel like a good sensation, massaging it like this?
Yes,
yeah.
very much so.
Yeah.
No pain, nothing. It just,
because
it's very relaxing.
By massaging all this dead fluid out, all this edema, it's putting less pressure on your nerves too. So now we're going to go with well, I call this the Jack the Ripper, but it's really, or the can opener, the nickname, but it's a concave tool, and it fits right perfectly on a convex surface. And I'm going to kind of frame the lateral malleolus and kind of milk out some edema here. Again, I also have the masking grip, which I've developed, so you have a good grip on that. No slippage, you don't have to put a lot of pressure or comfort for the patient because you're not white knuckling the tools. And I'm just going to frame the Achilles tendon. Again, I'm not going to irritate those stitches at all. That's got to feel good. Right
It
there.
does feel great.
Yeah. So I'm going to drain over this frame.
Should show Linda how to do that so I can have her do it 3 times a day.
There you go. Well, these 3 treatments, by the way, they should be standard after any type of surgery. I mean, it's just common sense, but and then after this, when we get the range of motion back, then you go to the physical therapy and have the rehabilitation therapy. But if you go to rehab right after surgery and the scar tissue is not breaking down, it's more painful because the tissue is not pliable, and sometimes people get worse, or it takes forever. And here I can use the tip of this, and I'm just framing. See, it's very going to be sensitive in here, but it's really going to help the circulation and break up the adhesions in there. Right there. So you can be very gentle with these. right there. So right now I'm kind of scooping that tissue out like that. And I'm just curious, I'm going to check his dorsiflexion and see if it's improved already. So bring this back. Alright, right there. Okay, now again, my standard is looking at the folds here. If there are more creases, the more dorsiflexion he has. So you're going to tell me when it starts getting painful. Look at that.
No pain at all.
Flex it more.
No
It's
pain.
not painful at all.
No pain. It's just,
Now look at the extra folds we got here. Before we only had about
That's unbelievable.
this much. See these guys?
Look at that.
Now this one's folding
I
up
can do it
here.
on my own. You know what
Look
I mean?
at look
at
on his
that.
own. I mean that's almost full dorsiflexion. I'm even going to put some overpressure, and you tell me what your limit is. Still good.
Yeah.
Look, even this fold's coming, and that's almost full dorsiflexion right there. All right. And what's going to happen is, of course, tonight the tissue, it's going to get stiff again, and of course it's not going to have the same range of motion we're getting now. But the more times we do this, the more adhesions we break up. The more fluid that's drained. The more stimulation of the peripheral nerves is going to actually kind of remind the brain that this is here, and we're actually stimulating his mechanoreceptors, which are made of, well, his large diameter afferent nervous receptor tissue, which is your Merkels, Meissners, Ruffini, Cassini, and corpuscles. Just giving this stimulation, which goes to the spinal cord, goes to the brain, will actually make sure he doesn't get any like peripheral neuropathy syndromes, the nerve damage of the myelin sheath. It keeps those receptors, those peripheral nerves activated. Not only that, another side benefit is small diameter afferent pain fibers, C fibers, and A delta, they're sharp pain acute fibers. Just by stimulating those fibers, it's going to send inhibitory pain pathway activation in the spinal cord just by mechanically, photonically, magnetically stimulating those nerves to inhibit the pain pathway, which is in lamina 2 of your spinal cord. Okay. So again, our goal is to drain and decrease the swelling and inflammation, get his range of motion back, and that way we can start with more aggressive strengthening exercises of the gastroc muscles, some ankle stability, balance training, stimulate all the proprioceptors in his plantar aspect of his foot, and that will get his proprioception back. And we want to do a lot of proprioception balance training, like balancing on your foot, and that forces your closed kinetic chain to activate along the whole body, right? So again, it's a stage process. Get rid of the pain inflammation, get the range of motion back, strengthening of the core, and functional movement rehabilitation, activating the nervous system in the closed kinetic position when you're standing. So right now. I'm just going to probably work a little more along the lateral malleolus to drain all this right here. So I'm just going to warm that up with the convex tool again right here. I'm going to keep that bandage on there. We can work around that. So when we work with these laser edge tools, I usually go in on a 45-degree angle, and the logo is also facing up. In other words, the bottom portion of all these tools is towards the treatment surface. So no matter where you're working at, the logo is always facing up, the bottom part's towards the surface right here. Tolerable? Just tell me when if it's intolerable there, Ed.
Okay, so
That's fine. No pain at all.
Good.
I can actually see it decreasing.
Yeah, the
it's like-
swelling, I mean, you're starting to
Yeah.
get more definition.
Yeah, I start laying here like this
Yeah,
at this
these-
angle.
Yeah.
I can see the swelling decreasing
Yeah.
while you're doing that.
And your leg isn't even elevated above your heart, it's
Yeah.
below, but still we could start getting more definition and vasculature around here that you didn't have before. It's one of my favorite areas to treat right here. It's it seems a lot of swelling gets caught in that crevice right in there. I just like to kind of scoop that out. Get all the vasculature up here. Say adhesions, just scoop that out. It's perfect right in there. Alright. So redo that again. Okay, so, and then another favorite tool, this is another kind of can opener shaped, concave, and this also works perfectly over the dorsal aspect of the metatarsals, and you can just gently milk that out there, and do a little scoop right in that crevice there. Again, we want the logo to be towards the top. How long was the foot surgery, Ed?
2 hours and 40 minutes.
Okay. No, they didn't put you under, they just put some local anesthetic
No,
in
I
you.
went under.
Oh, really? Okay,
Yeah.
the ether, huh?
Yeah, they knocked me out.
Wow. But when you woke up, did they put any anesthetic in there, or did you have to take some painkillers?
It was already casted at that point,
Yeah.
so I have no idea what they
I mean,
did.
was it very
I was in
sore?
recovery for an hour. No,
No?
I had no pain at all this
That's
whole
great.
time.
Wow.
It was unbelievable. Dr. Harris couldn't believe that I had no pain.
Yeah. Well,
I gave him back his pain pills.
yeah. Well, not to speculate too much, but you did get a laser treatment the day before, so maybe those endorphins were
That's
still
true. Well,
running
that's
through your
true.
veins.
You know,
Yeah.
you're right. I did get it the
Yeah.
day before.
So you could see,
Linda, you should see this.
as I'm draining that, you see how his skin is red there, and that's proof that we are stimulating some circulation in there instead of just staying white when I press
Yeah.
it there. So look at all that edema. I mean, if that edema stays in there, it could actually become hardened and cause cellulitis, and cause a lot of neuropathy. But here we can make sure we're draining all that fluid out.
You know, normally I would sense that I would have a lot of sensitivity and pain doing what you're doing,
Yeah.
and nothing. I mean, it's
Yeah.
it's
Yeah, and so
it's like a comfortable massage.
well, the laser and the magnet has an analgesic effect as well, so
Yeah.
it helps with the therapy too. So,
Wow.
and of course, when you go
I-
home, you're going to have some ice for the first 48 hours, and then more heat. Then we're going to contrast ice and heat, just to constrict the blood vessel and open it up. Contrast heat cold therapy. And I like to take this popsicle stick, and I can kind of get in these little hard areas to reach and kind of break all those up.
I could feel the fluid moving under the skin.
Oh yeah, isn't that?
Yeah.
It's a nice feeling. I mean, look at that vein right there. I didn't see that before. It looks like a dorsal pedis vein.
That's. If Patterson was here right now, Linda, he wouldn't believe this.
Well, we're gonna put this on YouTube and give him the link right there.
Dave will go. Well, he's chief
Come
of
on, take the pictures right
he's
with your phone.
he's chief of staff at Casa Colima.
Yeah.
That's one of the best rehabilitation hospitals in Southern California.
I'm gonna have to get my technique in your facilities.
He's getting ready to open his own section within the hospital.
But of course, with
the two
hospitals,
of you together, I don't know if the Earth is ready for that yet.
well, he's gonna have to go concierge, and since insurance doesn't cover all this,
I told Lauren I'd like Paul to learn how to do this.
yeah.
Well, I would think, why wouldn't they for the recovery and therapy?
They used to have this in a lot of hospitals, but they took them out. My theory is, because it works so good, if you're out of the hospital faster, they can't bill your insurance. Most hospitals operate on 3% profit margin, and in the past, hospital administrators used to get bonuses, well actually the CEOs of hospitals, on giving worse patient care, because the worse care, the more you're in the hospital with more procedures, they can bill you more. If you give good care and you're out of the hospital faster, they can't bill you as much and the hospital doesn't profit as much.
Yeah, but it's the
It's my
insurance.
theory.
It's the insurance company that turns us down. It's not the hospital.
Yeah, but still, the hospital, they want to maximize what they can bill, right? Duh. But now Obama's kind of cracking down on that. He's like penalizing hospitals. They're not getting as much Medicare reimbursement the longer you're in the hospital. Now they're incentivized to get them out.
Get them out.
Yeah, so.
Yeah, you've actually created right in there. You've actually created an indentation where your
Yeah.
left index finger
And then,
is.
because all this is non-invasive, I mean, there's no pharmaceuticals or injections involved. It's not profitable for the big pharmaceutical companies, who are the biggest funders of medical schools. So what's taught in the curriculum is, well, you need this pharmaceutical for this symptom, as if it's a vitamin. And then, they're the biggest lobbyists to get their drugs approved through the FDA, unfortunately. So.
Now, why do you keep referring to that as a bunion instead of a bone spur?
Bunion, spur, it's
They're
just
one of the
semantics.
same?
Yeah, I mean, combination as well.
All right, we're out here.